Can we stay on after?
Good evening in the UK and good afternoon probably in USA, right? It's a different topic today. It's about laser and open discussion with two of my colleagues, and they will introduce themselves. It's Monday, 6th of September, 2021, and we're going to talk about laser therapy itself. And as you know, this is a live session. And there's a disclaimer on live session. On live session, we will say something out of our mind. So therefore, please forgive us for that and advance apology. We're human being, mistake can happen. So don't hold us to that. So before I start, there are people from throughout the world who will watch this program, and hopefully you can interact. If you want to interact, the best place to interact is on my Facebook. You can easily interact within my Facebook. So please, if you could do that. So let's kickstart. If you could introduce, first of all, from USA, David, if you could introduce yourself, and we'll take it from there.
Yeah, my name is Dr. David Zuckerman. My first name is David. I'm a podiatrist. I think it's at least 40 years. You lose count after a while. In the last 20 years, I've been involved in the manufacture and importing of lasers. And these lasers it's called the Remy. I like to use mnemonics so you can remember things. The Remy is a powerful PPMA, powerful, portable, multifunction, which is very important and very affordable. Again, there's no salesman involved. Sumis is my UK partner, and I'm very proud to have him as a partner. Without him, the Remy would not be in the UK today. And we have another guest here who he mesmerizes me with his knowledge. So I hope we can help you today. This is a learning and an exchange. If we don't answer anything, feel free. As Sumis said, we will. You can reach us on Facebook or by personal email. We're here to help you help your patients. Thank you.
Okay, Abid, if you could introduce yourself, please.
My name is Abid. I'm a UK podiatrist. As soon as David talked about how long he was a pod, so I might as well talk about it as well. I have been a podiatrist for 28 years. Don't be fooled by these amazing good looks. I'm really old. I primarily see athletes and recreational athletes, and I see MSK patients primarily. That's 95% of my cohort. I've been using the Remy for a little while, and I would love to share my feedback with David and Sumis.
Thank you very much. I've already got one of my uncles saying hello. Thank you. He's joining me. That's who he is. So the platform is today's platform. Basically, David is yours and Abid Hussein platform. I think people are fed up with me seeing my face, right? So, and hopefully, both of you can interact, and I will learn. And if I want to get into debate with you, I will. So, David, the platform is yours. Thank you.
Okay, very quick. I would like the audience to know the Remy is not a new laser. It's a 30-watt dual wave laser. I've had it in the United States for over 3 years. We have well over 300 of these lasers out there. So it's something that has proven the test of time, and with procedures. But we always like to get experts involved, and that's why we have you to talk about. I'd like you to talk about your experience with the Remy, specifics. Let's try to get specifics.
Okay. Let's talk about specific conditions because it'll bring it into context. So, for example, the 3 or 4 conditions that I tend to see a lot of in clinic are Achilles tendinopathy, either mid portion or insertional, a lot of plantar fasciosis type discomfort, Morton's neuroma, I see a lot of other knee-related issues, including patella tendon joint pain and patella tendonitis. So before the Remy, I used to use Shockwave a lot. Now I use Shockwave and Remy. And what I have found is, for example, if I was going to do Shockwave for an Achilles tendinopathy, I would obviously do orthotics and a loading program that would be progressive, but I would do Shockwave treatment that would be normally about 5 or 6 sessions. Now that I've been using Remy first and then the Shockwave, that's cut down to 2 or 3 sessions. So I have made patients better much quicker, and ultimately that's the biggest buzz for any podiatrist, that you can get them back to the activity that they want to do as quick as possible. So that I've done that with Achilles tendinopathy very well. I've done that with plantar fasciosis. Morton's neuroma, I have just used the Remy on its own, and within 4 sessions, they've been pain-free. So those patients that didn't want an injection, specifically, I mean, recently I've had a whole bout of retrocalcaneal bursitis in the back of the heel. They've come to me and they're limping, they're in pain, they can't sleep at night, they're in so much pain. Within 3 sessions, I've got them down from a vast scale of 9 or 10 down to about 4. And obviously I'm doing other things as well. I'm not just doing the Remy. So I'm giving them exercises, and we're working on other issues. But with the Remy alone, within 4 or 5 sessions, I can return them back to doing the activity that they want to do and being able to have the quality of life that they want to do. So for me, Remy has become a mainstay in my practice. I use it every single day. All of my MSK patients, all of my sports injury patients. I have athletes from professional football, and I had a basketball player, my last athlete. She had patella tendonitis, and I used it on her. That was my last patient today, actually. But I use it a lot, so I can't talk highly enough of it. So yeah.
I have a few questions because protocols are different. And the more you understand this technology, the first thing is you have to have the proper diagnosis, the etiology. And it's not just the Remy, okay? It's a program. So that being said, I think biomechanics are important. Rehabilitation is important. How often, let's take a typical plantar fasciitis case. How often do you use it weekly? Do you use it once a week, twice a week? What is your protocol?
So normally for example, if I get a classic plantar fasciopathy patient, I'll do an ultrasound scan, I'll confirm the diagnosis, and I'll obviously do palpation and take in history. I do weekly appointments, and within 4 weekly appointments, vast majority are better. The vast majority, I would say 95%. There are 5% of people that need more. But this is where diagnosis comes in is very important. Like I recently had a patient that was referred to me for Remy, but they actually had a mid-portion tear in the fascia, which wasn't diagnosed, I'm going to do a PRP injection on that. So this is where diagnosis is very, very important. Those are my colleagues. I mean, most of my colleagues know, but you need to have like a differential diagnosis in place before you attack it with anything, shockwave or laser.
So one question to Abid Hussein. You talked about combination therapy. How well would you define a combination therapy with class 4 laser, regardless of what class 4 is?
Are you talking about how often do I do the
what would be a good combination therapy, like shockwave, acupuncture with the laser? What goes well?
So I throw the kitchen sink at some of my athletes that need to get back to their running or their football or their sport quick as possible. So Remy is a mainstay, shockwave is a mainstay. After the first appointment, I'll start to do acupuncture. In the third appointment, I might then use Compex, which is like electrical muscular stimulation, dry cupping. I will do different things, and every time I'll be changing their exercise program, and I'll be looking at other things that I may have missed out during my consultation. So I always keep an open mind to think, is there something in the proximal structures that is affecting the lower limb, especially if for example, if you have a tennis player, they have certain forces that they're putting through their pelvis and their lower body. So I'm always thinking that obviously I'm going to do the Remy, but I'm always thinking holistically regarding every patient. But yeah, I will combine other treatments, but the class 4 laser is my mainstay.
Can I ask you? So
Yeah.
your initial approach is the Remy class 4 laser. When there's, I always use this mnemonic, which no disrespect to anybody, but it's called pain in the ass. M. P is for pain, and you can add to this or detract. Pain is P. I is inflammation. A is arthritis, and M is lack of mobility. So pain in the ass. So because a lot of doctors, I consult with hundreds of doctors, and I try to teach them a foundation. You know, can I do it for neuroma? Well, if there's inflammation, you can. Howard's limitus, if there's inflammation. It's amazing for Lisfrank's joint. We have arthritis in the top of the foot, even apophysitis. Do you treat children? Have you found it?
I'm a bit, so I haven't treated a child with it, and I'm seeing BYSA at the Birmingham Youth Sports Academy. I'm seeing children week in, week out. I'm using the Remy primarily with adults. However, I have used it for a couple of children that had Osgood Schachter's, right. And I got some brilliant. That's Anwar Khatak, who's BYSA. But I have used it for Osgood Schachter's disease, and that was very, very good. But I personally, I'm a bit wary regarding apophysitis. But I do realize, David, that the evidence is in the favor of using it because there's been 2 papers. This is my own personal choice. Maybe at some stage I may be a bit more confident with using it with children.
Anwar Attaki said you help him for his academy. What it is, if you could. Thank you anyway, Anwar.
I take care of all their plates, from groin injuries, hamstrings, pars injuries at the moment, which is in the back, and foot and ankle.
Also, they have academy in Birmingham, or what is it? What does he do?
Yeah, so we have a elite academy where we have players that play at in a league, but we have over 400 kids every week that come to play football. I take care of the elite players. Some of our players have been picked up by big clubs, Premiership clubs, which is good. But yeah, I take care of their elite players, which is interesting because you get to see groin injuries and stuff. But I am going to get to a stage where I feel more confident with using it with an adductor longus injury, for example. I've got 2 of those at the moment in my players. As you know, Abid, the beauty about the Remy, if Dr. Zuckerman can show us, it's the portability. You can actually take it to the field. It's battery operated. There you go. It's brilliant.
So it's brilliant. Yeah, there you go. It's that portability. It's Android. Currently, Android is the market to be in because you can change things, and it's cloud system. I can go on and on.
So, Miss, you convinced me of that. In the United States, where Europe was the market Android that started me, but with your help, we've got it so sophisticated that I'm completely switched over to Android in the United States, completely. And I thank you for that. So we're talking about children. Again, it's PPMA, powerful, portable. The Remy is a dual wave 980, 810, 30 watt peak. It can go to CW 25, which is plenty of power. But that being said, we talk about multifunction. Let's talk a little bit about warts. Your experience with warts. Tell me about it. What you think?
I've had really good experiences with warts. I've done it to children and adults. It's not painful. It can sting for a little bit, but generally, if you're quick, once you get used to the technique, which is very important, it can really help to get rid of the wart very quickly. So my protocol for verrucas using the Remy is I do a treatment every 4 weeks, and I will treat all the verrucas. I think it's a good option within our artillery of different treatment options we do have.
How are you finding their ability to go back when you use sal acid and what we call, I don't know if you have canthrone, which causes a blistering effect. How do you find that they're able to get back to their normal activities? Is there a lot of downtime with warts?
There's no downtime. They go back to their activities almost straight away.
Yeah. And all the protocols with the Remy are FDA cleared. Yeah. And it's very simple. I mean, here's the therapy handpiece. If you want to go to warts, you can time me. We're now back into warts. It's that quick. The Remy was designed with the practitioner and, more important, the patient. You know, you need to have something that's fast, quick, and very low maintenance, which is what the Remy has been. We've gotten tremendous amount of feedback for verruca or plantar warts, and you're right, there is a little bit of a learning curve to this, but the people that have stuck with it, you know, it's a touch, it's a feel, you know, it's an art, but it has a pretty quick. How would you say? You said it took a little time. It's not months. I would say, you know, it's treatments. It all depends on the individual doctor. Which the beauty of it is we train you. You know, when you get the Remy, it's not here you go, goodbye. We all are podiatrists, and we train. And I mean, I'm always available for training. I certify everybody, and we even give CME credits. But the key is we train you, which is the big advantage. You know, getting a laser, even though I personally think the Remy is a laser that is much. I don't know a laser like this. I mean, I've been in the business for 20 years, and this is the best laser I've ever gotten. But the training and the support is extremely important. Okay. I don't have the answer.
Thank you, David. On that aspect, I'll show you what Remy is. So just bear with me. It's got body set program. Rotation. That's the beauty, and that's the advanced technology with Android system. Now, Abid, my question to you. I know you used many type of system, and you're still using, and you are venturing another thing lately, which we are going to do in October. So how did you like the Android system?
It's good. It's really good. It's intuitive. It's easy to use. I have nothing but positive things to say about it. It's fine. I have. It's very easy to use. Everything is all laid out for you. You have pre-programmed programs in there, and you can create your own programs, which is what I've done as well. And once you get to an advanced stage, you'll choose different things. You could choose the home screen, and you can choose whether it's a large patient or a small patient, acute or chronic, and go that way, or you can go into the pre-built programs that we've got. Depends on the individual practitioner, how confident you are. But I mean, in the UK, you've always got someone and myself to always come and talk to if you've got any questions regarding the Remy. And David's obviously a few hours behind us, so he's asleep at some time. So we don't want to disturb his beauty sleep. Although he looks like he doesn't need much of it because he hasn't aged he hasn't aged at all. But yeah, I mean, you've always got myself and Somas that you can ask us questions.
Yep. And one thing I mentioned about the protocols, you know, the Remy can it can go from low, medium to high energy, from 0.1 watt. I mean, I'm not saying there's an indication. I personally was trained in high intensity lasers. You can go continuous wave, you can go pulsing. All of the programs that you get we're going through extensive safety protocols and approval by the FDA. If that means something to you.
I want to mention one thing. You've got, for the MSK heads, we've got two wonderful heads. I don't know if you've got them there. Now, one has got a crystal ball on it, all right? The other one is a standard one. They are awesome. Now, some patients, they cannot manage with the standard head. You would have to use that crystal head. That crystal ball head, using with the laser, is very unique. I don't think I've ever played with another laser that has the same therapeutic effect as the other head, which I'm sure David will show us as well, but without any discomfort. And I'm a big fan of that particular head. So this is the standard head. This is the one I would use on most patients. But if you find that the patient cannot cope with the heat from that, then instead of putting the settings down on the laser, just change the head, because you're still getting the same power going through. It's just a lot more bearable.
Plus,
So,
you can use with the rolling ball as a crystal ball. It's unique. Like as I said, I haven't.
I love it. You can massage into it. You really work into it. If you're working on Achilles, you can come up into the gastroc, into the soleus, really work through it. Work all the way into the insertion. Obviously, there are some laser systems, and I'm not going to say good or bad things about them. No. But there are some laser systems where you just focus the light and it's there. Personally, I'm not a big fan of them. I like to have the control of moving the laser and working the fibers in different angles rather than just a singular angle. So, for example, if you were doing plantar fascia, you would work all three bands of the fascia rather than just focus on the enthesis. Well, I would. So you would also work on the ankle mobility, because it will help the ankle mobility. And if you help the ankle mobility, you're going to help the plantar fascia. And you would work on the Achilles tendon on the insertion, because we know it comes down from there. So yeah, this is why these are a couple of the reasons why I'm a big fan.
Another question to you, Abid, is as well with class 4 laser. Like I said, all class 4 laser to me is good, because I want everybody to enrich in a laser, a class 4 laser. It depends on what module or what system they buy. It's their individual choice. Right, but since you had that Remy class 4 laser, how did it improve or enhance your practice? Because you've been in practice for the last 25 years or plus.
28
so what was
it's changed a lot, because what's happened is that the word of mouth has got around. Treating 1 or 2 patients, everybody got to hear. So people started coming to the clinic asking for Remy before I even got a chance to even talk about Remy, which was interesting. The other thing was my diary gets filled up very quickly now, because I know I'm going to see the patient for like a minimum of 3 or 4 sessions, and it gets, so you can plan your income levels in that state. Although we're not going to talk much about money, but it is I mean, there's nothing wrong with making money as podiatrists. So it's not against our religion. So I hope not. Anyway, so it has been profitable, and I would recommend. I personally would recommend it for all private pods. I think.
Another question is, as you know, instead of buying many systems, right? This one, the Remy, it's all in one. It does surgical. It does wound management. It's MSK. It's fungal, right? Spider veins, and I can go on and on. So it's one machine packed into so much.
So you can.
How many probes did I give you?
Yeah, you've given me all the probes, and I've used them all. So everything from God.
There you go.
So I've used that. We've got the 2 MSK probes, the optic fiber one. We've got the fungal nail one, the one that comes like that. Where is that?
Yeah, that's this one.
I love that probe. Okay,
ENT we call it. Ear, nose, and throat.
This one.
That one there, that's brilliant. For fungal nails, okay, just for fungal nails alone, it has a massive success rate, especially when you combine it with some like micro drilling. When you combine it with micro drilling on the 4th or 5th session, and you've been doing class 4 laser, you'll get awesome results, and patients will love you for it.
I had very good results recently, right, with laser combined with shockwave. Only 3 sessions, 80% improvement. I couldn't believe it.
And it's interesting in the United States. One of the reasons why I thought of the Remy is that Ahmad, you pointed out that there's nothing wrong with making a profit. You have to make a profit. We're in business. If you don't make a profit, and the only way you can do that is I always say it has to be effective, affordable to the patient, but you can't spend, I don't know what this is in pounds, but the Remy is at least 50% less than most laser. It's not 50% decreased quality. It's because we're the manufacturer. If you're talking to a salesman as opposed to a podiatrist or a healthcare professional like us, we want you to have this. We're not interested. We want you to have this because you're going to refer to us and you're going to help your patients. We're going to help you. My goal is like you have an iPhone. Okay, here it is. I want everybody to have a laser so they can help their patients. And the only way we can do this is make it affordable.
Absolutely. I actually think that most podiatric clinics that are in private practice should be able to pay this off after a couple of months. If you're not, then you need to talk to me about business, because you definitely should be able to pay this off quite quickly. It is very affordable compared to, and it's multi-use as well. So you're not buying different lasers for different things. Like I've had a laser just for fungal nails and it doesn't do anything else. It just does fungal nails, and this does everything. So yeah, it is very affordable.
And another thing is, go ahead on.
And with current issue with phenol, Abid, isn't that fabulous? Remy can do.
Yeah, that's something that we need to look more deeply into.
That's something very matrixectomy we're talking about. That's another art. It is being done. But it needs more. The Remy is cleared for ablation, incision, excision, vaporization, and ablation. So it is indicated. But we have to work.
We got 3 minutes, gentlemen.
Sounds good. I just want to point one other thing out. Is that you need marketing support with anybody that purchases the Remy. We have customized brochures, posters, videos. We're even starting with Facebook posting. I don't know how important Facebook posting is for you, in the UK, but we're here to make it successful. That's our bottom line. We want you to be successful. It's not, again, I always say the relationship begins once the laser is placed in your office. That's what I enjoy. I enjoy teaching, educating, and experience. I learn from you guys just as much as you learn from me. It's an interaction.
Thank you.
I feel grateful that I've met both of you. I'm being sincere. I feel very, very grateful because I get a different perspective. We have so many lasers, Remy lasers in the United States, and I'm going to be showing this to my US colleagues. There'll probably be 10,000 podiatrists that will see this interview today. I always say if you can pick up one thing, just one thing.
Another thing, Diana Woodridge is here, David. It's an amazing piece of equipment. Patient and me are completely blown away. Thank you very much.
Thank you. Pleasure again.
Right. Abid, last comment?
I would highly recommend the Remy laser. It will, more important than anything else, it will have a massive impact on your patients. It will. It's a very effective treatment modality to use within clinic.
Thank you, everyone. Thank you for watching, and I hope this was a live show only for half an hour because we don't want to take your time, especially in the UK. We're having a cracking weather, right? So thank you for watching. Again, I said it's a live talk show. We may say something. I'm sure we haven't said anything much, which would be detrimental to the profession or anybody else, but it's just open discussion. Open discussion about laser and the usage in our practice, right? So therefore, I believe it's an educational that we understand about laser and its modality, regardless of what system you use. Class 4 is currently quite powerful system for podiatry, MSK, sports medicine, and etc., etc. Thank you again, once again. Thank you very much, and have a lovely evening.
Thank you. Bye-bye, guys.